Hey there, PT and PTA students. Welcome back to Studying with Stephanie. I'm so glad you're here today. We are continuing our topic on the spinal cord pathways, and we are talking about a descending motor pathway today. We are talking about the reticulospinal tract. All right, again, I love to talk about the spinal cord pathways, similar to a delivery truck driver carrying a certain signal. All the delivery truck drivers are going to go on different routes through the spinal cord in order to get their packages to different locations. We call a package drop-off a synapse. So when a synapse occurs, that drop-off happens, and now that delivery truck driver is going to take a different route to get to where it needs to go. So let's get into it. What is the reticulospinal tract? Well, the reticulospinal tract is a motor pathway, so it is a descending pathway, meaning it is starting within the brain or the brainstem and going down through our spinal cord until it hits a muscle in order to produce a voluntary movement. What a voluntary movement means is that I'm consciously thinking of it. So when I'm talking and my hands are moving, this is a voluntary contraction. It's happening because I want it to happen. Talking, happening because I want it to happen. Versus breathing. Breathing is involuntary. It's going to happen because it needs to happen to keep me alive. So that's the difference there between voluntary and involuntary. So the reticulospinal tract is going to help produce voluntary motions. And again, these signals come from our brain down through our spinal cord until it reaches the particular muscle. The reticulospinal tract is cool because not only does it influence voluntary motion, but it also influences autonomic function. Autonomic function is things like breathing, things that we do not control. They are autonomic. All right, so it also influences that. In that regard, it also influences muscle tone. So is our muscle flaccid? Is it hypertonic? Is that muscle really tense, or is it really atrophied? So the reticulospinal tract originates in the brainstem. It is a network of neurons. And this network, again, influences that voluntary motion, those autonomic systems, and our muscle tone. So we have two different tracts for the reticulospinal tract. So the medial reticular spinal tract is going to originate from the pontine reticular formation. That is kind of a subtlety that as a physical therapist, it's good to know. You might get asked on a neuro test, but it's really more crucial to know what these things do. So the medial reticulospinal tract is going to influence increasing muscle tone. So when we have more flaccidity in a muscle and we're trying to gain strength, that medial reticulospinal tract is going to help increase the tone of that muscle. And it's also going to facilitate voluntary motion. So it's going to help you move how you want to move. This pathway moves from that pontine reticular formation down ipsilaterally through the anterior funiculus of the spinal cord. So it's going to go down on the same side, meaning it's going to control the same side of the body as where it comes from our brainstem. All right? We're going to move on now to the lateral reticulospinal tract. Now, the lateral reticulospinal tract starts from the medullary reticular formation. So very interesting because the lateral reticular spinal tract starts in the medullary, so that kind of sounds like medial. So try not to get that confused there. This is going to start from that reticular formation within the brainstem, and it's going to travel bilaterally. So it's going to go down both sides of the body. What's going to happen with this, the lateral reticulospinal tract, is it is going to inhibit voluntary motions and inhibit muscle tone. So it's going to reduce muscle tone and it's going to prevent certain voluntary motions. So the reticulospinal tract really helps us to create smooth motion, to improve our motor function, to help with our reflexes, help with our muscle tone, and to modulate voluntary motion. So not only are we going to get smoother motion, more controlled motion, it's going to help with how strong and how impactful our muscles are contracting. It's going to get that sensory information, read it from the brain, and produce the proper signal to get the best form of motion and the best quality of motion for you when it comes to those voluntary contractions. Any damage to this part of the spinal cord is going to affect things like spasticity, flaccidity, motor coordination, and just motor strength, as well as just having gross motor impairments throughout the body. Because again, the medial reticular spinal tract goes ipsilaterally, but the lateral reticular spinal tract goes bilaterally. So that's the reticulospinal tract in a nutshell. I hope that this video helped you. If it did, please like and subscribe. If you want more videos like this, or you have any additional things that you want me to go over as you're studying through your neuro, cardiovascular, ortho, anything that relates to physical therapy school or PTA school, I am here to help you. Drop it in the comments below. I would love to hear from you. Thanks so much for coming to Studying with Stephanie, and have a great day.